And today I will speak about management of large vestibular schwannomas, radiosurgery, and fractionated radiotherapy. Vestibular schwannoma is a benign, slow-growing tumor which arises from vestibular portion of vestibulocochlear nerve. And first time with radiosurgery, it was treated in 1969 on a gamma knife by Dr. Lexell in Karolinska Hospital in Stockholm. As we all know, treatment can be divided into two large parts. It is surgery and radiotherapy. And radiotherapy can be divided into three lower parts. It is single fraction treatment, fractionated radiosurgery when we are using 2 to 5 fraction treatment, and fractionated radiotherapy or conventional radiotherapy. And stereotactic radiosurgery is a small lesion radiotherapy with large irradiation doses and with steep radiation fall-off outside of the target volume. And here you can see radiotherapy techniques which are mostly used for radiosurgery: gamma knife, Linac-based technique, and CyberKnife robotic radiosurgery system. Indications. Indications are newly diagnosed and continuously growing vestibular schwannomas and recurrent vestibular schwannomas following surgery, and tumors which are located in intracanalicular space, and small tumors and without brainstem compression. Goals of treatment: it is high rate of locoregional control and tumor growth, and anatomical structure and functional ability preservation for normal tissues. And we can find several papers about vestibular schwannoma treatment, and one of them is a large multi-session study with 383 patients, and studies show that multi-session radiosurgery treatment results in an excellent rate of tumor control, and the hearing, trigeminal nerve, and facial nerve function preservation was promising. A very important function during radiosurgery is hearing preservation, and the decisive factor for hearing preservation is cochlear region. And we can find several information about this maximum dose to cochlear region, and it is starting from 9 gray in one fraction, 9 gray to 12, 13, and 14 gray in one fraction, and 17 and 25 gray in 3 and 5 fraction treatment. And in our clinic, we are trying to accept plan when this maximal dose to cochlear is less than 9 grays. Potential benefits it is of radiosurgery is high rate tumor control, facial trigeminal nerve preservation, and hearing preservation. And also it is lower risk complications than it is after classical surgery. And in this table you can see comparison of different clinical studies, dose regimens, tumor control rate, and complication rates. And we can see that the highest complication rates numbers for vestibulocochlear nerve is when we are treating patient with a single fraction treatment, and a little bit lower it is when we are using multi-session treatment. And also complication risk for facial and trigeminal nerve are rather low. Single fraction treatment are applied for tumors in diameter less than 30 millimeters or 8 cc. Tumors preferably without cyst when the patient have clinical symptoms and when we see the tumor growth. And multi-session radiosurgery we are using when we diagnose recidivism, when there's residual tumor tissues after surgery. Tumor diameter is more than 30 millimeters, and also patient have clinical symptoms. And treatment contraindications for radiosurgery are significant brainstem compression, hydrocephalus, and stable disease in years. Here you can see doses and regimens for vestibular schwannoma treatment. And nowadays it is possible to evaluate vestibular function before treatment, and we can evaluate it with so-called test, which is called video head impulse test, and also hearing function evaluation also is very important. And in this picture we can see this video head impulse test, which is called HIT. During this test, doctor get information about vestibular function according to vestibulocochlear reflex. And this HIT examination captures abnormal eye movement, analyzes it, and displays it on a digital graph, which is easily read and understood. And here we can see two pictures. And on the left side, here we can see that this vestibular function is normal, but at the right side we can see that there is some different graph, and for this patient, this vestibular function is not good. And also our clinic is involved in a clinical trial, and we are evaluating our patients with this video head impulse test before radiosurgery and 3 and 6 months after radiosurgery. But as we start work only 2 years ago, and we start to involve these patients only several months ago, we can now show results yet. And about our practical work, during these 2 years, we have treated 26 patients with vestibular schwannomas. Mostly, we treat patients with one fraction treatment. And about hearing function, majority of patients have normal hearing function, and 8 patients of them had video impulse test examination. And from those, 3 patients had reduced vestibular function. And here we can see the number and doses for vestibular schwannoma patient treatment. And majority of patients had one fraction 12 to 14 grade treatment. And treatment results with treating patients with vestibular schwannoma on CyberKnife M6 system, there was no acute post-irradiation reactions, and there were no local progression after 6-12 months, and found hearing impairment of 8 patients, and for 3 patients, a group who were tested with this HIT before radiosurgery, 3 months after treatment, vestibular function was getting worse. And conclusions, radiosurgery on CyberKnife M6 system are effective and safe method of treatment for patients with vestibular schwannomas and allow to avoid serious neurological complications and keep high quality of life after treatment. And now a little bit about clinical examples. This patient is with right side vestibular schwannoma, treated with one fraction, and treatment volume was 1.7 cubic centimeters. And on the picture, on the picture on right, here we can see the treated volume, and on the left picture we can see MRI control picture after 1 year, and we can see that this tumor reduction is reduced very little, but there is some changes in contrast enhancement. This is a patient, one of the first patients treated on CyberKnife machine in our clinical practice. And patient with a rather large vestibular schwannoma, and treatment volume was 12 cubic centimeters. And the patient has surgical treatment 4 years ago. And after 2 years, this neuronoma was progressed, and patient decided did not want to have a surgical operation second time, and he come to our treatment, and we treat him with 5 grade 5 fractions, and on these pictures. Here you can see the treatment volume and neuronoma at the beginning of treatment. And this picture is after 1 year of treatment. And here is a reduction in tumor volume by 40%. And yesterday I get email from this patient, and he make MRI control after 1 year, and now this neuronoma reduces by 30%, and this volume now for this schwannoma is 5 cubic centimeters. One more patient with right side vestibular schwannoma was irradiated and treated after surgery. Patient with also with grade 5 fraction treatment, and in pictures you can see this tumor changes also in size after 1 year. And there is also one more radiosurgery machine in our country, and it is in Riga, in Latvian Oncology Center. And this patient is treated also with multi-fraction radiosurgery, 8 grays with 3 fractions. And here in pictures on the left, you can see this control MRI after 3 years. And also we have treated patients with conventional radiotherapy. This is also a young woman treated on a Novalis Dace. And she had she had a classical surgery, but after surgery there was rather far progression, and she come to our center, and she was very emotional and very afraid of radiotherapy complications. And my colleague decided to treat her with conventional fractionation.